Okay, that takes care of that. All right, everybody. Welcome, welcome, welcome. I know we've got a few people that are pouring in still. I'm sure we'll probably have several people come into this session once I get going. But for those of you that are here, we want to get rolling with this so that we can make sure that we stay on time, keep this presentation as succinct as possible. So again, it's Cody Strait from from Access eForms. I'm the Director of Strategic Initiatives here at Access. I've been here over 15 years, and what we're here to talk about today are the issues that are faced on the back office side of a hospital, primarily the purchasing area, and how we see a lot of our customers and a lot of other hospitals out there using paper or email or Word or something like that to conduct their business processes. So today we're going to focus on how we can help with that, all right? And this session today, this webinar, it is being recorded, okay? So we're going to make sure that everybody has that available to them after this session. So if you have some colleagues that you think you'd like to show this to, then you certainly will have that opportunity. All right, this is a webinar format. We've got a lot of people here on the session today. And so because it's webinar format, it's going to be a bit more like a lecture, right, where it's going to be me going through some things, again, just so I can get through things as quickly as possible. Everybody here, of course, is on mute. But because everybody is on mute, that does not mean that we don't want interaction from all of you, okay? So interaction usually comes in the forms of questions. So if you have questions, please give them to me, all right? So if you look at the GoToMeeting user interface, you're going to see a tab that says questions. So if you would be so kind as to, while I'm going through this session, type your questions into that box. That would be really great. And I'm going to monitor those questions. Matter of fact, if you just want to type something in there now to test it out, feel free to go right ahead and do that. But like I said, I'm going to be monitoring those questions throughout the session, but I probably will address all of them at the very end, okay? And I'll stick around as long as you guys need to for me to address all the different questions, all right? And by the way, this is a session geared towards purchasing managers, materials management directors, so and specifically inside of the healthcare industry. We're not focusing on any particular subsection of the healthcare industry as it pertains to the purchasing process, such as we're not focusing on Lawson, we're not focusing on PeopleSoft or Meditech or the McKesson system or whatever other type, Microsoft Dynamics or whatever other type of system that you might be using on the back office side of the hospital. This is a fairly general session, but if you do have some questions specific to any of those vendors that I just mentioned, then by all means, ask about those and we'll cover that, okay? All right, so back over to this. Customers across many industries. Look, Access started out as a healthcare organization. We've been around doing this for about 20 or so years, but because we started to develop solutions that could be used in the back office of the hospital, it was really interesting. People started finding us. All these other organizations started searching us out, and so we have grown outside of healthcare. That's where we got our start, and again, that's where our focus is. That's our pedigree. But we've grown outside of that. I've just put a variety of logos up here, some of which you guys will notice, some of which maybe not. But higher education, government, retail, there's just a variety of industries out there that are using these types of technologies, because one of the things that we've discovered on this pathway where we've developed these solutions are that HR is HR, purchasing is purchasing for the most part, from one industry to the next. Is healthcare different than retail? You bet it is, in so many different ways. But as it pertains to the back office processes, forms are being passed from one person to the next for approval. There's more things that are in common across industries than are different. So again, there's just a few of our customers using the technology. Like I said, we are a healthcare focused company. That's where we got our start. That's our pedigree. That's where we put our development dollars towards. And so as far as healthcare is concerned, across the U.S., across Canada, across the Caribbean, Europe, England, so on and so forth. We've got well over 1,000 hospitals using our technologies in some way, shape, form, or fashion. So again, healthcare, we know that very, very well. All right. I would ask you guys, if I was in a big group, how many of you use this? How many of you guys use this or email perhaps to get a form from one person to the next for approvals, right? This right here is what we call like the lowest common denominator, all right? If you are using this today, if my sales reps, my team goes on site and they see one of these sitting on your desk, they're going to ask you, what's inside of that? What's inside of this interdepartment mail envelope? And pretty much 100% of the time, we'll ask, what's inside, and we will actually be able to convert that to a fully electronic process, all right? Because usually when things are being sent from one person to the next, it's for approvals, all right? So whatever, if you're still using this today, people will say, how can I use this? What forms should I use this for? I always bring it back to the interdepartment mail envelopes. What are you stuffing inside of these things to get from one person to the next for approval? Okay, so across the hospital, there's a lot of things. Again, this is going to be a materials management and a purchasing focus session. So, as far as those form examples are concerned, though, here's a variety of them. All right, I'm not going to go through and read this list. And like I said, I'm recording this session, so you can come back, watch the video, pause it right here. But you see HR forms here, with the employee evaluations and travel requests. But then you have a variety of other things, budget requests, direct deposit. You got a risk management, accident or incident report form, capital requisition form, internal job transfer. So there's forms here all across the board. And let me be clear again, while we will be focusing on the purchasing process here. This solution can be leveraged across the other areas of the organization, right? This is not a niche solution that just does capital expense reports only for Lawson customers, okay? It can be used for a variety of processes here, all right? Here's the overview of the technology, real simple. It is a browser-delivered solution, okay? So all your end users need to have is a web browser to access a form, electronically fill it out, electronically sign it, and then submit it for approvals, okay? And because it's a browser-delivered solution that is based in HTML5, that means you don't have to have any other sort of plugins or anything like that to make this work. What this means is you can access forms, view forms, complete them, sign them on any device. So you can see I've got an Android device listed there, an iPhone, a Microsoft Surface, but whatever you're using, we can access a form from those devices, again, fill them out, sign them, etc. Then from there, as far as once the documents are complete, we can also route the forms. So these forms are accessible from any device and also anywhere. So I'm looking down the list of people that are here. I know that some of you are from health systems that span across a multitude of sites. Okay, you've got maybe 3, 4, 5 hospitals. Some of you on this session, I believe, actually have 20 or more hospitals. And so no doubt you span across multiple states even. So one of the biggest things that we see is, the big challenges that we see is not just making the form electronic, but it's automating the workflow or approval process. And so typically speaking, you'll see somebody that's maybe in Texas and they'll be routing a form to somebody that's over in Maryland that then routes to somebody in Colorado, and then from there somebody that's up in Washington. And with us, you can do that, okay? People don't have to be inside of a physical building to be able to approve forms. Again, being that they can access these forms from any device, they can also access these forms from anywhere, okay? So the mobility implications here are really unparalleled as far as where you can take this. There's nowhere in the world that you can't take this so long as you have connectivity, and of course anytime. There's no time frames, of course, which you can access or cannot access these forms. So delivery. Let's talk about the workflow component to this. And again, as we were developing the solutions, we quickly found out that the value in what we had to offer was not that we could make a form electronic, right? We can make a form electronic, great. You know where else you can do that? Microsoft Word. You can do that with Adobe. You can do that with an array of other desktop applications. So making a form electronic really not that big of a deal, all right? It's the workflow is where the problem really usually lives and concentrates, all right? So getting a form from one person or one place to the next has been the issue. So what we're able to do is automate the approval process. All right, of course, there's no more paper being passed around, certainly no more emailing. One of the biggest issues that we hear about too whenever we're talking with potential clients about their paper processes is bottlenecks and the inevitable lost form. And that's always a big problem, the lost forms piece. And so we're able to eliminate both of those. And like I said, the workflow is automatic, but the workflow is also dynamic. And I'll talk about that in just one moment. But one of the ways in which the workflow is automatic is that we're going to know who, like your reporting structure, your hierarchy. So we'll know who reports to whom. So you actually can have these forms routed around based upon roles. So as one person approves a form, it can go to their manager, their departmental VP, or whomever else it needs to go to in the process. But in any case, once a form is initiated and it's routed around from one person to the next, again, these people can view the forms and electronically complete and sign them on any device. The data that we collect is actually mobile, and we're able to put that data that we capture from the forms into different databases and then sometimes different systems like the Lawson system, okay? Another, excuse me, another example of the delivery where things get to be a bit more complicated. What I just showed there in the last slide was pretty much a linear delivery where it goes from person 1, person 2, person 3, person 4 in that succession. But we can accommodate many other aspects of our types of workflow. But one of the things, though, that people always ask us about is our ability to attach basically supplemental information to these forms, all right? Because usually if you're putting a capital request form through in an interoffice mail envelope for approvals, you've got along with that contract specs, pricing or whatever it is, okay? With us, you can attach that same supporting documentation and it flows through the process as well. So again, if you're doing a capital request form, you can attach all the things you need to attach to it and then submit it for approval. So it goes from one person to the next person for approval, then it continues to move on forward through the workflow, but then we can deviate from a linear workflow and we can go through a concurrent workflow where if you had a situation where you could have 3 different people, as per this example, viewing and approving a form simultaneously, that saves so much time because you don't have to wait on one person to approve it and then the other person to approve it and then finally the third person to approve it. You can have a variety of people looking at, reviewing, and approving the form simultaneously. That cuts down on so very much time, all right? Okay, then once these 3 individuals have approved that form, it goes back down to a singular person. Now, from here, let's say that the originator wanted to know where this form was through the approval process. Now, if you're using paper, interoffice mail envelopes, if you're using email where you're emailing forms from one person to the next, if you want to find out where this form is, this originator of this form process is going to have to pick up the phone. They're going to have to call people and say, hey, did you get that capital request I sent through? Yep, I got it. I forwarded it to Susie. You call Susie. Susie, did you get that capital request? Sure did, and it went on over to Randy. You call Randy. Randy says, nope, I never did get that capital request form. Well, somewhere in there the form got lost, and then of course you have to track it down. It's a big problem. With us, you can actually electronically track forms at any point in time. So you can see, in this case here, I actually need to get a better shot of this, and I'll show the product working in a second. But we've got a form here. In this case, it's an account turnover form. And you see we have a submission date. It was submitted by this person. Then it went to this person. It went from this person then to this person. So you can track the form and see where it is at any point in the workflow. So again, lost forms are eliminated, all right? Another feature functionality that's really nice is that the workflow, like I said, it can be dynamic. So if you've got maybe, let's say a CEO needs to approve anything that's $25,000 and above, all right, which is oftentimes what I hear with most of our customers. So if what this purchase request represents is beneath that $25,000 threshold, so let's say $19,000 or whatever, then it would bypass the CEO for his or her approval and go then from that, directly to wherever it needs to go, over to purchasing to complete that capital purchase request. So you're seeing a variety of things occur here as far as the workflow component of it. And again, I'm going to demonstrate this in just a moment, but I'm also going to be demonstrating it, by the way, with our own live system, meaning we here at Access, we actually use this technology for our own internal business processes. So we novel concept, we use our own products. So anyways, a couple things that I want you guys to understand, all right? If you're thinking about what does this mean, right? So think of it this way. There's a study, Process Critical Forms in the Mobile Workforce from AIM in 2002, and what they calculated is that a form process generally is going to cost about $7.40, all right? And that's because of all the employees that have to put hands on it, the time, the materials, all these other sorts of things. So let's say that you do this for 150,000 forms, all right? That means 150,000 forms. That means $1.1 million or so is spent on that, okay? So if you look at this and you say this process that occurs 150,000 times a year is costing us $1.1 million in employee time, what can we do to improve that? So what we're all about doing is, and what our customers generally experience, is efficiencies and speed. Okay, a process that used to take a very long time no longer takes such a long time. So if you think about that $1.1 million, what does that mean if you can make that more efficient? Let's say you can make it more efficient by 10%. What does that mean? That means $111,000 is what that means. Just 10%. Just make it 10% more efficient. What if you can make it 20% more efficient? Obviously, $222,000, all right? And I'm not going to continue going down the scale from there, but you get it, okay? So small improvements can mean big dollars from employee time savings, material savings, etc., let alone, of course, the whole aspect of lost forms and the trouble that goes with that. So let's take a look at this, and after this I'm going to jump into the actual product. Let's take a look at one of our customers, all right? North Kansas City Hospital. By the way, whenever we get done with this session, we're going to be emailing everybody the video of this session. We'll also give you the link so that you can go and view the North Kansas City Hospital case study that gives a lot more information about what it is I'm about to show you. So North Kansas City Hospital, they started using our technology several years ago. They're a site, obviously, in Kansas City. The name implies they're a Cerner hospital in the clinicals, and they are Infor/Lawson on the back office, which is where they're using us, okay? They started out with 15 forms. They took 15 forms that were going through a paper process to our system. When they did that, what they saw was it was reduced the time that was required by each user by 84%. Okay, so we're not talking about a 10% efficiency or a 20% efficiency. We're talking about 84% efficiencies here. The average time that it took the hospital to complete a form process was about 2.2 weeks per process. Once they converted to our system, it was 2.4 days. So again, 2.2 weeks down to 2.4 days. And then as they had calculated it out based on the employee hours that were spent dealing with the forms and the lost forms and all of this business, it was over $300,000 just time savings over the course of 15 forms. Okay, so again, we'll give you the North Kansas City Hospital case study and you'll be able to see everything there. All right, so the question slide. All right, so that means I'm done there. I'm going to jump back over into this. And here is, and guys, I see a few questions coming in. That's great. Again, if you've got questions or comments, feel free to type those in that questions tab. And I know we have a few people that did just join us. All right, like I said, this is a technology that we're not just selling it to other organizations. It's a technology that we actually use internally, okay? And there's some other healthcare information technology companies out there that also use this technology. For example, Meditech. We're a partner with Meditech. Meditech actually bought this technology from us to solve their own business processes for their organization of over 4,000 employees strewn across multiple states at over 8 different locations. Okay, so it's a solution that we use, but other HIS companies use it as well. All right, so like I said, this is our live system. So what I've got right here, I'm in what we call our forms catalog, and you're able to create different form groups. So I've got a form favorites group. I'll talk about that in a second. A sales team group. I've got a professional services group. I've got various things here. HCM for us stands for Human Capital Management. So I've got admin, onboarding, self-service. Then I've got employee forms and support services business. All right, and from here I've got public forms. These are forms that can face outside of our firewall. Okay, the form favorites group, that is where I can actually take the forms across the different groups, and I can add them into a form favorites group. So this is a grouping of forms that I personally use most often, that I've cherry-picked, if you will, from all of these different form groups that I have access to. So you can see I've got a performance management form, marketing project request, internal professional service request, expense reimbursement, capital expense request, account turnover, and business card order form. Okay, so that's the ones that I find myself using most often, that again, these forms are strewn across these different groups. All right, so what I'm going to do is I'm going to launch up our capital purchase request. Okay, so here is our, well, actually that one's demo one, but go back over here. Business. And for some reason I can't find my purchase request now. Awesome, fantastic. In any case, we'll go with this one. All right, so this is one that we see oftentimes our hospitals being using, so let's just roll with that. So you can have facilities here. You actually can have that as a drop-down list name if you want. You can add a project name to this, capital type, you can do that. We can also bring in employee information automatically onto these forms, and that goes all the way down over to cost center or multiple cost centers if you wanted to do such things. And then from here, you can type in, of course, whatever different capital item that you're buying and the amount, and of course everything there is calculated automatically for you. Of course, for some of our customers, I believe we have some customers here that wanted to watch this, so this is for the purpose of the recording, people that wanted to watch this from England, so we can transition this over to the British pound sterling, no problem, or some other form of currency. Like I said, once I complete this form, I can also attach documents to this, so I can click on this button and I can then go out and grab anything that I've got saved on my hard drive, such as, again, hardware specs. It could be pricing, a quote, a contract, or whatever, and then I can sign off on this and submit this. Sorry again that one is probably not our live one. Let me go back and let me pull up, at the very least, let's go through our expense reimbursement. So this one certainly is our live form here, okay? So what I'm able to do for the expense reimbursement is I can choose, the date of the expense. Let's say it was May 31st, and I can say it was a flight to a customer site, and let's say that the customer was North Kansas City. Now notice that this pre-populated with my information and also my direct reports information up here as well. So I can file this under transportation. Let's say that the flight was $425, and I'm tabbing over, and I paid for it with my Amex. All right, so $425. Now let's do this too. All right, then on the first, I had lunch, and I'm going to put North Kansas City again, and let's say the meals were $20, but over here I'm going to put 19. Okay, so a few things that you're going to get with this. Now I'm going to go down here. I'm going to try to sign and submit this form, and again, this is our live form. Now notice what it says. It says, "Oops, please enter the beginning date of this expense report." Okay, so and it carries me right over here. You see, I forgot that. I did not add the beginning date of the expense report, so I'm going to go May 31st. Now, if I did sign and submit again, it's going to go through the same process. It's going to say, hey, don't forget to put your ending period from. So I'll do that and I'll say that it is June 1. Now from here, what I'll do is I'll click on Sign or Submit, and notice what it says. Item number 2, the total amount of payments tendered must be equal to the total amounts under the business expense. So what we're doing here is not only are we making the form electronic, but we're also trying to eliminate the human error. So $20 over here is what I said was the expense, and I said I paid for it with my Amex card, but it was $19. So I'm going to go back, I'm going to change that to 20. All right? So that takes care of that. So we're trying to eliminate those errors, those problems. One of the biggest issues that we hear about as paper is being routed from one person to the next is that something was filled out inaccurately or lacking in completeness, right? And so we want to make sure as much as possible that we can negate that common human error, all right? So I'm going to go again, click on Sign or Submit, have you attach the receipts. This, if you notice, I have opportunity to say yes or no. This is just a reminder because, again, we're human. So I might have forgotten to attach my receipts. Nope, carries me back here. I can go out, click on Attach Receipts. It'll bring up that window, and then I can attach receipts. Also, if I'm filling this out, it's not uncommon that I'll get a phone call or I'll have to go off to another, deal with something else, and I want to save this and pick it back up later on. Well, I can do that. I can click on Save, and it saves it right in my record. So then I can go back and pick it up right where I left off. Now, what I'm going to do here, I'm going to change this because, like I said, this is our live system. And this will actually go through our approval process. All right, so do not approve this for a webinar. Okay, so I'm going to go to Sign. Have you attached the receipts? Sure, I've attached my receipts. Now it's going to give me a username and password. All right, so I'm going to type in my username, password. My username is Sluppy77, which is really silly. Should have thought out about that before I use public webinars. And you can see it was signed by Cody Straight at this date and at this time. All right, now what I could see from here, I'll go back into my system, I can get an email that actually tells me, Cody, you have submitted an expense reimbursement. That's how we have it set up. And whenever it goes over to my supervisor, David Wilding, whenever he approves it, we have it set up so that I'll get an email saying, David Wilding approved your expense reimbursement report, okay? And then it will move forward. Or corrections need to be made, go back and correct it, or it was rejected altogether, okay? So there's that. Now, what I've also got over here is I've got my forms. Like I said, this is all the forms catalog, but I have my forms. Now, email is a really nice way for to have notifications. Like right now, my colleague David Wilding is getting an email from the system that says, David Wilding, you have an expense reimbursement report that is from Cody Straight that requires your approval. So David gets an email and there's a link within that email. But what we can also do is go over here to my forms, and I've got an inbox, and an in process, and completed. So I can click on my inbox, and here are some forms that I actually need to view and approve. Now these are some kind of old junk forms that I need to get rid of, but because they're from a long time ago. But I could click on this form and I could view it, sign off on it, and approve it. All right. Now I'm going to go back to in process though. So like I said earlier, what we're trying to do is eliminate the lost forms here. So you can see I've got a variety of forms. I've got expense reimbursement right here. This is the one that I just submitted. And it said submitted by myself, and it's currently waiting on David Wilding. So just at a glance, I know where this form stands. I know who has it. I know that it's not lost. All right, so the whole thing, like I called David Wilding, hey David, you got that expense report? David says, no, I never did get it. I can look right here and say, actually you did. All right, now if I wanted some further details on that particular form process, I could click on this I over here for information, and it's going to show this. It's going to say, this was submitted. Now, the reason it says from Cody Straight to Cody Straight is because I actually saved it, meaning that I could come back and work on this at a later point in time. So that represents a save. But then it was sent from me to David Wilding, at this date and at this time. Furthermore, I can also click on this right here, and it would give me a read-only view of that form. Again, I can't change it, but I can see it. Now, going back down in here to one of these other forms, let's have a look at this. Okay, so you can see this one was sent from Cody Strait to Haley Hill on the 18th at 11:09. But then at 11:41, it was sent from Haley to Chuck Demery. Now, here's the cool thing. Cody Strait, that's me. I'm in New Hampshire, just above Boston. Haley is in Sulphur Springs, Texas, and Chuck is in Tyler, Texas. So within the span of just a very brief period of time, it went from me to then two different people in different places in Texas. All right, so pretty cool what we're doing here. So with that being said, I can continue on. I can show other form processes as to how we're using this. I can, you know, guys, we can handle government forms. Matter of fact, I'm looking at the list of questions here. One of the questions was, can you handle government forms? So, matter of fact, let's transition this over into the Q&A session here, because I have gone at the amount of time that I wanted to go for this, which was 30 minutes. I wanted to keep it relatively brief here. So one of the things that I'll look at, let's take a look at our onboarding. All right. So I'm going to pull up the Alabama A4 holding form, and there you go. Okay. So this is a government form. So it's already brought in my information. It can bring in my other information too if we wanted to do that. And then from here, I can add data to this. And of course, it will, let's see. Okay, so I could type in the ones and the zeros with this, and it would automatically give the calculation here. So again, we can handle government forms for these types of things. Here's an example of an I-9. Okay, again, I know that we're talking about purchasing here, we're focusing on these things, but I'm only showing these so that you guys can see really how it is we're able to handle these government types of forms. And notice with this one, you've got a multiple pages. You know, this actually is a 9-page document. So he's got my information. This is the government form. It looks just like the government form. And you know, as you see here, I can only select one option here, so it's just the same sort of thing. It's only allowing me to complete the form accurately. All right, if there's some other forms that you guys want to see, some other things you'd like for me to go over, I will be very, very happy to do that. But for now, let's jump over to the questions. All right, so here's a good question. You mentioned Lawson earlier. Can you put data back into Lawson once your form is complete? It's a great question. The answer to that is yes. Matter of fact, that's exactly what we're doing over at North Kansas City. One of the areas that we're saving time over there is that whenever a purchase request is completed through our system within their environment, all the data that we've collected, we're able to provide that to Lawson in a means by which they can consume it. So the answer to that question is yes, yes we can. Okay, here is another question. By the way, if you have more questions to add to that, please feel free to type the question in there. Another question here is, where are the completed forms stored? It's a very, very good question. So the completed forms can remain in our system. You're able to do that. However, our system, of course, is limited in scope to our technologies. So while you could have all the different forms that you have been part of or privy to or started or completed, that's great, but that is, of course, nowhere close to being a complete record of anything pertaining to the patient or a specific process or anything of that nature. So typically the way that hospitals use us is they'll have another system there inside the hospital where they're doing scanning, but what we can facilitate is a paperless process. So rather than having to print out one of these completed forms, we're able to then route this completed form electronically, usually by converting that form to an image, right over to that scanning system, which in many cases is the perceptive content product. That's the Highland On-based product. There's a McKesson Horizon Business folder if you're using the HBF piece of things. So again, we see a variety of different things out there. So very good question. Here's one question is, can the system calculate tax for a purchase request? That answer is yes. We can do that. We have a lot of customers doing that, so that's just really easy to do. As far as setting up the multiplication factor, that's not a problem at all. All right, another question, can we do this with iPads? So yes, you can do this with iPads. You certainly are able to do that. Like I said, this is really accessible from any device to be able to view the forms and complete the forms and sign the forms. Because the reason it's able to remain device agnostic is because it's a browser delivered solution. Actually, that segues us really nicely over into this next question, which is this a hosted solution? That answer is no. No, it is not a hosted solution. We can host it, but usually our customers have wanted to have this on-premise, okay? That's the way that usually works out. There's another question. Can we change our own forms, or do we have to pay you to do that? Also a very good question. So, like I said, we've been doing this for a long time in healthcare, and I'm going to try to give you a little short answer to this is, yes, we allow you to change your own forms, create new forms, because we're all about empowerment of the customer. And back in the day, that wasn't really the case as it pertained to the other forms vendors that we were trying to displace. So we really wanted to do something different in that we would empower the customer to be able to make changes to their own forms on their own time without having to pay us any money. It's kind of saying like, we're not going to hold you hostage to your own forms. Another question here, do I have to be inside our firewall to view and complete forms? Well, there's two answers to that. There's a policy question, or policy component to that question, and a technology component to that question. From a policy standpoint, every organization, of course, has their own IT security policies, as they should, all right? So there's that component, and I can't answer that component for you. Is this available outside of your firewall? Well, it certainly can be, okay? I'm logged into our system all the way over here from New Hampshire, but I'm on my own home Wi-Fi, okay? So there's that. We have a lot of customers that have these forms that they're, accessible from outside the firewall, and they're viewing them and completing them and approving forms while they're, just kind of moving and shaking outside the hospital. They're out to lunch, they're out to dinner, they're on a business trip, they're at a conference, you name it, we've seen it. Again, these are great questions, so feel free to keep those coming. I've got just a few more here set up so far. All right, another question, how hard is it to design forms? Look, everything's relative, all right? I'll say this because, I'm paid by access, so I always take anything that, anybody says that's paid by another company with a grain of salt, as I would expect you guys to do from me. But how easy is it to design a form? Let's just say this. The forms are HTML5. And to produce HTML5 forms otherwise, you have to be a really good coder of HTML5 language to produce those forms. So it's not easy. We provide the design tool that has a really simplistic graphical user interface where you don't have to do any coding to draw a box or draw a line or create a drop-down list or create a radio group or anything of that nature. So really, if you're proficient with Word and Excel, those types of things, then you're going to be totally fine using our design tool. Okay, here's a question. Is that design tool, is it a client or is it web-based? It is a client. It is not a web-based system or web-based tool. The end user, again, their experience is web-based, but the tool set is a client. All right, here's a really good question, and this is the last one that I'm seeing here. So again, if you've got other questions or follow-up questions, please feel free to add those in the questions tab of the user interface. And the question reads, can you launch a form, your form, from another system? So it's a really good question. We see a lot of different customers wanting to do these sorts of things, and I'll say that, can we do that at a very broad level? Yes, absolutely we can do that. Our system is launchable. You can launch a form or our solution from another system, and we can even bring over information from that session. We can do all this really, really cool stuff as far as launching ourselves from another application. Now, like I said, that's a general answer. And the reason it's a general answer is because there's some systems out there that, don't have that ability to launch something. So while we are able to do that, not all systems are created equal in that regards, and so there's some systems that just simply can't launch our application. All right, good questions, guys, really good questions. That is the last question that I'm seeing right now. Let me go back over to this. For those of you that are still here, I know we've had a few people drop off, but like I said, we're pretty much done at this point. Look, that's me. There's my various numbers because I also handle our international business. So I got a lot of different. There's a lot of ways to get a hold of me. There's my email address. If any of you have any questions over what you've seen today, or you maybe would like to have some more conversations with us directly about your situation as opposed to a webinar like what we're doing here today, which is obviously general in nature, then great, we'd love to do that. So feel free to reach out and contact me, go to our website, fill out the Contact Us page if you wanted to do that. Like I said, we'll be sending each and every one of you guys the video of this session as well as the North Kansas City case study, so you'll have an opportunity to email us back from that as well. But we're here for you. We're here to help out in any way. We really appreciate you guys, so thanks a lot and have a wonderful rest of your Thursday.